So much for joining us today in celebration of National Public Health Week. It's my pleasure to welcome you to today's webinar, Now More Than Ever, Inspiring the Next Generation of Public Health Leaders. As we kick off today's discussion, feel free to take a moment to introduce yourself in the chat, share where you're from, and answer the prompt. What inspired you to pursue public health, or what excites you most about the field? My name is Omari Richens, and I'll be serving as today's moderator. I'm the founder and CEO of the Public Health Millennial, where I help you learn, navigate, and transform your career. I host Public Health Careers podcast and share advice on career and public health all over the internet. Today, we'll hear personal stories from three This is Public Health ambassadors about their journeys into public health, why they chose this field, and their ambitions to make a difference. The Association of Schools and Programs of Public Health has a long-standing volunteer program where graduate students from membership institutions assist with each aspect of the recruitment cycle. We will soon be launching recruitment for next year's cohort. More information can be found in the chat. We also joined this afternoon by a passionate group of public health faculty who will share their expertise and engage in a dynamic conversation about the opportunities and challenges shaping the future of public health. This webinar is being recorded, and you can view it at another time if you step away or have to step away for any reason. We're thrilled to have you here, and we're looking forward to a meaningful and motivational conversation today. So let's dive in. We're going to start off with our student stories. And just a quick note regarding camera usage, please have your camera on while you're sharing your story, and panelists are welcome to either keep their cameras off or you can have them on as well. So we hope that these sentiments shared by our ambassadors leave you feeling inspired and aware of the important impact you can have on the future of public health. All three of these students will be graduating this spring, so early congratulations to all of them. Firstly, we have Remy McIntyre from Temple University. She's pursuing a Master's of Public Health in Social Behavior Sciences, as well as a Master's of Social Work. Ready?
Hi, everyone. So I just want to share with you guys my journey into public health. So growing up, I saw firsthand how socioeconomic factors impact the health outcomes. Though at the time I didn't really have the words for it, I had family, friends, and neighbors facing challenges like access to essential resources, housing instability, poverty, deplorable school conditions, and just simply access to healthcare was a problem as well. I knew I wanted to be someone who could help, but I didn't know how then. So I just knew the people I love were struggling and that I wanted to do something about it. I realized that these weren't just isolated incidences and struggles that people were experiencing. They were part of something bigger, which I learned later was social determinants of health. That's simply what led me to the field. That desire to solve problems and find real solutions in my community is what simply led me to public health. I've always been community driven. And I saw public health not just as a way to make systems level changes, but to make these changes for families and communities that will be supportive of them. Not just in moments of crisis, but also through policies, interventions, and education. On the left-hand side, you'll see what inspired me as a mural in my community where I live. I want to share with you just more about what impacted me and what made me drawn to this field as well. So I'm really just driven by like community, as I said, that's my commitment. I don't want to just study public health. I actually want to live it. I want to be in the work creating interventions that are rooted in community needs and using resources that tell stories that lead to real life solutions. I simply believe that data becomes powerful when people represent their stories as lived experiences. So for me, my goal is to use research and direct change in services to create change to access life, child, and maternal health, health equity, and social determinants of health that shape entire communities. I personally see public health as the bridge between individual care and systems changes. So whether it's through the programs that supports families, policies that create access, or just education that's meant to empower us, the field of public health literally just gives me the tools that I need to make that kind of impact that I've always dreamed of. And that's one that's literally driven by community changes, starts with people, and is grown to a lasting change. And I thank you all for joining us today.
Thank you so much for sharing, Remy. And I think it's so important to highlight that public health can be used, the skill set can be used in so many ways to impact lives. Next, we have Rashmi Humagain from Massachusetts College of Pharmacy and Health Sciences, who's wrapping up her MPH. Rashmi.
Thank you. Namaste and good afternoon, everyone. I'm originally from Nepal. It's a country known for its beautiful mountains, rich culture, but despite of its beauty, Nepal still faces deep healthcare challenges, especially in the rural and remote areas. I started my career as a dentist. I graduated in 2019 and made a decision to begin working in Ilam. It's a district on the eastern part of Nepal. I wanted to experience healthcare delivery in rural Nepal to truly understand the challenges people face, beyond the city hospitals. I spent 2 years serving communities there, people who were incredibly kind and resilient. They yet had to travel hours just to access the basic healthcare needs. After that, I worked for a year in Kathmandu, that's my hometown and the capital city. And this move allowed me to clearly see the gap between the urban and the rural healthcare system. In the city, the resources were more accessible, but in Ilam and in so many different other parts of Nepal, people still struggle to get proper diagnosis, treatment, or even health education. Working in both these settings made me pause and think, was I truly making the impact I wanted to? I was treating one patient at a time, but I kept wondering, how can I, have an impact to a larger community? That is when I found my answer in public health. So today I am pursuing my Master's of Public Health at Massachusetts College of Pharmacy and Health Sciences, and I'll be graduating in May 2025. This journey has helped me understand health is not just from the clinical lenses, it has the systemic and the social perspective in it. It has helped me connect the dots between the healthcare access, education, policies, and equity. I'm currently doing my internship at Cambridge Health Alliance Healthy Smiles program, where we focus on the oral health for the community of Cambridge. And during my time of practice in Nepal, one issue I saw repeatedly, especially in the remote clinic, the ethnic communities, was alcoholism. It contributes to so many different health problems, and yet there is little to no support or awareness programs in those areas. There were also people who delayed care or never received it, just simply because healthcare infrastructure wasn't there. They couldn't travel the long distances required, and often it was the most vulnerable population that suffered. This is why I'm in public health. I want to be a part of a solution that brings healthcare to people, especially to those who cannot reach it. I want to work in the community-based projects, the mobile health initiatives, or any culturally sensitive program that actually reach people where they are. I want to create a change from, the ground up. After graduation, I plan to work here in US for a year to gain more hands-on experience and in the community health sector, and then I'll return home to contribute to Nepal's health system and eventually plan to work with the Ministry of Health. My goal is to help design and implement programs that uplift rural and underserved communities because health should not be a privilege of geography. As you can see in the picture, that's me in one of the health camps that we did in one of the remote communities while I was in my undergrads. I'm in public health because I want to ensure that everyone, no matter where they live, has the right to health, to care, and to hope. Thank you so much.
Well, that's very inspiring and really highlights that public health is global health and it can be applied across the world. Thank you so much, Rashmi. And last but not least, we have Toluwalase Akinlui, who is completing her Master's of Public Health degree from New York University.
Thank you for having me. My name is Toluwalase, but I go by LA. I did start my journey in the clinical side of things, just like Rashmi. At the age of 13, I saw a movie and knew that I wanted to have a fulfilling or impactful career because the physical therapist in that movie helped the footballer to get back his career and get back on his feet. So I studied physical therapy at Nigeria's Premier University. However, I practiced for 4 years and I realized that I wanted to do more. I did not just want to treat symptoms or one patient at a time, while the root causes lingered deep-seated in inequity, in policies that are non-existent, poor infrastructure. So I made the move and applied for a master's in public health in policy and management at NYU. And so far, that journey has been so impactful. I've been able to contribute to meaningful work. I have also achieved a number of feats just with my contributions, like winning the World Bank Youth Case Competition, getting the Johnson & Johnson Inspire Award, where I actually did my internship and worked with the patient advocacy unit in Global Medical Affairs team. Also, I was just 2 weeks ago at Capitol Hill to the ASPPH as an ambassador, like you know, and currently I'm also a graduate research assistant at NYU Langone. And I particularly like the work I do because I'm translating the evidence from our research into actions, into strategies, into policies. And that's why I really enjoy public health. Next slide will show like where I see myself going. And if you look at the images, one says, I am public health, and the other says, reshaping the future of care. So, not just doing public health, I am actually public health. And that's why I want to first always spread the word. So, for every time I get the opportunity, like I'm currently doing now, we need people to know that public health is not scary and it's not one of those things you do just because the world is crumbling. It's what we are called to, it's what the world needs. And it's definitely a passion that we have. One of my favorite quotes is that public health is contagious, so we only have to be carriers. So, and then I want to do more of research to continue to translate evidence into policies and continue to champion advocacy, like I recently did at Capitol Hill, where we were able to speak with Congress officials about funding the academic side of public health. And lastly, I hope to be able to advance an advisory role with the government to focus on health equity to reshape systems. So from downstream to impacting communities to upstream advocating and changing policies. Ultimately, thank you so much for having me. And I do hope that everyone here listening is inspired to champion change and go for public health, leave public health.
Thank you so much, Toluwalase. I think I love that. I never heard that before. Public health is contagious. Yes, we are all public health. Definitely appreciate that. Thank you all so much, ambassadors, for sharing your wisdom, your stories, and your experiences with us. Definitely inspired me, and I hope it inspired someone in chat. And as well as huge congratulations for getting through your Master in Public Health work and looking forward to seeing the impact that you will make in the field. Before I move on, don't forget, if you haven't as yet, drop why you chose public health or why public health chose you in the chat. But we are going to be transitioning into our discussion with our faculty panelists. The questions you included when you registered were used to craft a lot of the discussion that we'll have today. And I'm very appreciative that you were able to share that to give us a better grounding of this conversation. Each panelist will provide a brief statement about their perspective on the role of public health in today's world. They will touch on things like their educational background, professional background, and the evolving landscape of public health challenges, or what inspired them to pursue public health. Before I turn it over to them for introductions, I would like to note that our panelists are joining us as leaders within the field of public health. They have kindly agreed to participate today as individuals and are not speaking on behalf of the universities with which they are affiliated.
Great. I'm up first. So hi, everyone. My name is Liz Chen. I lead the Health Behavior and pH concentration at the UNC Gilling School of Global Public Health. Way back when in undergrad, I took a medical anthropology course with Joao Biel my sophomore year. That truly changed my life. And it was in that course that I realized that I was more interested in the prevention of disease than I was the diagnosis and treatment of disease itself. So I graduated at the end of the Great Recession when the job market was really lousy. So not knowing what area of public health I was particularly interested in, I chose to work in adolescent health through the K-12 school system. So I taught high school science in rural Eastern North Carolina for 2 years. And that's how I realized that I really wanted to spend more time understanding adolescents, health, and then also the integration of public health and K-12 education. So I went on to earn my MPH and PhD in health behavior in my home department at UNC before joining faculty. And along the way, I was trained in human-centered design by the world-renowned design firm IDEO. I co-founded a tech nonprofit, was named to the Forbes 30 Under 30 list for social entrepreneurship, and recently published a book on experimentation through Columbia Business School. I'm here today to really underscore the key point that public health is everywhere, and we really do need a transdisciplinary workforce that breaks down silos between fields, values different kinds of lived experiences as well as training, and one that's ready to redesign the future of public health together.
Good afternoon, everyone. It's a pleasure to be here, and I'm so thankful for this opportunity to share with you all. My name is Daryl Hudson. I am the chair of the Department of Health Behavior and Health Equity at the University of Michigan School of Public Health. My public health journey I fell into. So I wasn't as smart as many of you all are on the webinar today. I ended up doing public health related work where I was an undergrad at Morehouse College in Atlanta. We were doing CDC funded work, but I didn't really know what public health was. I'd never taken a public health course as an undergrad. From there, I went on to the National Institutes of Health. So I was at the National Institute on Drug Abuse. I was very fortunate to become what we call the IRDA. So there's a post-baccalaureate IRDA, which stands for the Intramural Research Training Award Program. So I worked at NIDA. I was at Hopkins campus, Hopkins Bayview, and I did smoking cessation work research among teenagers in Baltimore, Maryland. And being at NIH, being at Hopkins, the public health bug bit me. Prior to that, I thought I wanted to be a psychologist. And so I majored in psychology when I was an undergrad at Morehouse and really started to think more broadly. As I thought about my own first classroom, I would say my first classroom is Detroit, Michigan, where I grew up. And so thinking about and reflecting on the experiences that I had, experiencing the inequities that I now study. So we could see inequities in education, food systems, healthcare in general, transportation, so on and so forth. So there were so many issues that at that time I didn't have the words to articulate what was happening in my community, but that's what inspired me to go into the field from the things that I witnessed. And so I think that now being in the field for a long time, I wouldn't choose anything different. I think that right now is critical for what we need in terms of leadership and contributions from the next generation of leaders, scholars, so on and so forth, practitioners. And so that's what I try to do in the work that I do now, especially being a department chair. I try to think about preparation of the next generation. And so my public health goal is to put myself out of business. I envision a world where the inequities that I and my colleagues study are obsolete, to make it so that as many of us know, our geographic area, our zip code doesn't determine so much in life, including our health. And so that's what I'm here to do, and that's why I hope that I can stand shoulder to shoulder with many of you in the years to come as we're in this struggle to achieve health equity. Thank you.
Hi, everyone. So I'm Dylan Roby. I'm department chair in Health Society and Behavior at UC Irvine in the Joe C. Wen School of Population and Public Health, and I'm also a professor in the department. I am a health policy person, so I do a lot of work on health insurance access and health disparities related to community health centers and public hospital patients. And, you know, like Liz, I think my pivot happened in undergraduate as well. I was fortunate to attend UCLA in the late 90s. And Michael Dukakis, who had run for president against the first George Bush and lost that election, was a visiting faculty member at UCLA every winter to escape Massachusetts winters. And so I took a class with him, and my project in that class focused on kind of figuring out what went wrong with Hillary Clinton and Bill Clinton's efforts to reform healthcare in 1993. And so that really got me thinking about health policy as a career. I ended up being fortunate to work at one of the first health policy centers at UCLA, the Center for Health Policy Research. and got some exposure as an undergraduate to like what goes on in research, but also what goes on when you're trying to translate research into evidence to convince policymakers what the right answer is and actually use that evidence rather than being like the traditional kind of stereotypical ivory tower academic, which I think is unique about public health. Like those of you who are getting into MPH programs or PhD programs, public health faculty do have a translational aspect to their work that other disciplines do not. And so you're actually able to contribute to change through generating evidence rather than, your book sitting on a bookshelf gathering dust or somebody not reading your paper. So I was able to go to George Washington University where I earned my PhD in public policy, but being in DC allowed me to work at a couple of different trade associations and kind of get a taste of what happens on the policy side. And a lot of my interest is around like how politics works to influence the process, how the budget process works. And so a lot of that is becoming helpful this year because of there aren't that many people who understand budget resolutions and budget reconciliation and all the opportunities that are going to occur over the next 6 months around policy change through these very kind of opaque processes that are going on in Congress. And I also spent a lot of time at UCLA at the Center for Health Policy Research there, and now here at UCI, I do a lot of state-partnered research. So looking at Medicaid waivers and how to use evaluation, but also policy analysis to guide stakeholder decisions. So it's a very meaningful career for me. I think, I started in the late 90s thinking about insurance access issues, and a lot of those things have been solved in my career, which has been very inspiring to me. But now we're tackling this new world of there are certain more vulnerable populations who still don't have insurance coverage, still don't have access to care, and there's still existing disparities for that population. But now we're facing an administration that doesn't value eliminating those disparities as we've seen in the past. But I think having a public health background lets you kind of see all of those angles because you're trained interdisciplinarily and are able to understand who the different motivations from different political actors and actually synthesize it and use it rather than kind of taking a step back and saying like, I don't understand this at all. I'm just going to give up and be passive. You actually have agency to make change and kind of protect the populations you're interested in protecting. So thanks very much.
Hi, everyone. I'm Inbal Shaham. I am a professor in the Department for Behavioral Science and Health Equity and the Associate Dean for Research at the College for Public Health and Social Justice at St. Louis University. It is great to be here today, and it's fun to listen to my colleagues and the students already talking about what they're doing, what they want to do, and what we did. It is wild. So I will say that I slipped in and got really lucky and landed in a master's program at University of Georgia for public health. I did not anticipate this is what I was going to do, but it was the only one that offered me an assistantship. And I am first generation. I'm an immigrant in the first generation college student, graduate school, all of it for my family. So no one really gave me advice and I didn't know what I was doing. I could have found mentorship, but I missed it. I landed at this amazing program and really learned what public health was. And I remember the feeling of like, this is what I'm supposed to do. That connection changed everything, my whole path. And I also thought I was going to be a therapist. I studied psychology undergrad. And I think one of those opportunities that translates into action happened. And so I had volunteered in my undergrad at a children AIDS network. This is showing my age also. And we don't have those anymore because we have very few children in the United States that are born with HIV anymore, which is tremendous policy success. And I think one case is too many. So particularly, I remember thinking like, I want to get rid of HIV. How do we get rid of HIV? And I realized that people over in this neighborhood were engaging the same behavior as these people, but these people got HIV. And that's when I was like, that's inequity. And I didn't know that. I also, so I learned about that. And right after my graduate program, I was able to work in Atlanta doing HIV prevention work at a large HIV service organization. And what we were able to do is learn a lot of the community work, learning about listening, radically listening and understanding how we can move together. That shared language mattered. We didn't use those words then, but thinking about how do we motivate each other to work together and change outcomes for communities is the key. After that, I was able to work at CDC for a while, completely shifted focus and worked on physical activity and trying to get kids more physically active, which was super fun. And it's like not my research most of the time, but I also still think about it all the time also. I left CDC before the Verb campaign, for those of you who knew that then, before it was over, because I wanted to be I wanted to run that campaign, not to get my colleague and supervisor out of her job, but also because I liked that work. I really enjoyed the leadership, thinking about how the impact of a public health campaign could have for the United States and for internationally. And so I looked for doctoral programs and I found one that had the the potential to go to Kenya to do my dissertation work in HIV. And I was like, well, I'm going to pick that one. That's the one for me. And that's how I did it. And so I would go back to Daryl. I've been working to try to get out of a job, particularly around HIV. We should have been there, and now we're only going to ramp up our challenges about access, inequity. And HIV has medical advancements that really give us the chance to live a life without HIV, but we're not there. And so now I got a postdoc and at Washington University in their School of Medicine and ended up staying in St. Louis, and now I'm at St. Louis University. It's been a wild career, and I just think that partnering, being open to opportunities and not knowing what you're going to do is also good, but also thinking about in the context that we're all living now is to think about we want to do community. You may want to do community work, but community work may not be at a public health agency. It might be at the local government. It might be at a housing organization. So we have to be creative, but you're trained and being trained in competencies that are translatable. And I think that's a really important opportunity for all of us. Thank you.
Hi, good afternoon, everyone. My name is Eva Silvestre. I use she, her, and ella pronouns, and I'm really happy to join you here. In terms of educational background, but first of all, I'm also an immigrant, so it's nice to see other immigrants represented on the panel. I'm from Guatemala, and we came to the United States when I was a child seeking political asylum, and we were undocumented for a while. So I continue to have a lot of sympathy and work with immigrant communities here in the United States. And in terms of my interest in public health, I have been interested in public health since I was a child. I still recall watching movies, like public health education campaigns in Guatemala as a child, specifically about the prevention of hookworm infection. And this is where, I'm so old, and this was, in the 70s in Guatemala, where it was literally like the sheet in a public place where they would, show you this educational movie. And I still can remember, the images from this movie about preventing hookworm infection. And so even when I was in high school and living in an immigrant community in South Florida, I wrote my admissions essay for college on about how I wanted to work in global health. And so I studied nutrition with international development minor at Cornell University, and then decided that I wanted to continue to look at nutrition and health issues, but from an anthropological point of view. So I went and I did a master's in anthropology from the University of Colorado in Boulder. In between that, I should say, I worked at a public housing authority for 2 years in between my undergrad and my master's. And that is what really helped me make the decision that more education is really what I wanted. And so then I went and I got my PhD in international health from Tulane University. I really loved anthropology. I thought it was great, but all of my interests were really applied. And in anthropology, the focus was a lot more on theory and how is your research advancing theory. And at the time, I was really interested in humanitarian issues, particularly around refugees. And I was very happy to see that so many of the folks who are joining us in this webinar are international. I saw Nigeria, I saw Ghana, I saw Ethiopia, I saw Brazil, Iran, etc. And so that's very exciting for me to see because we have a lot of international students here at Tulane, and I'm always so happy to see them. My work has been more focused on international health, particularly in countries in sub-Saharan Africa. So to my Ethiopian colleagues out there, I lived in Bahir Dar when we were implementing a large health management information system project. So my work had been funded through CDC and then also more recently through USAID. And I was one of the folks who lost a 5-year project. We were in year 1 of a 5-year project called the Global Health Pearl, which focused on in the space of monitoring and evaluation, research, and learning. So to me, that is a big challenge, right? Is the loss of a lot of foreign aid assistance from the United States, and it was, it came as a very big shock to me. But the reality is that these problems globally, locally are going to continue. And I'm going to borrow from somebody else who I heard them say this. The revolution will not be NIH funded. The revolution will not be USAID funded either. And so we really need to focus on these problems and continue to work with our local, community partners, whether it's here or in Nigeria or in Sierra Leone. I'm currently listening to the book, Everything is Tuberculosis, which I highly recommend because it is really kind of bringing me back to what was it about global health that really mattered to me? Why is this important? And to really think about all of the systematic issues that prevent people from getting things like tuberculosis treatment or getting diagnosed that they have, to figure out what is the correct medication they should be on. And so I really have found this book to be really inspiring and to kind of center me and bring me back to what is important for me and what brought me to public health, what attracted me to public health. And thank you. I look forward to our discussion.
Well, firstly, I'd like to say thank you all for the work that you all have done in your careers. And I'm hugely honored to be here today to have this discussion and moderate this discussion, as well as the wide expertise that you all are bringing. I think there's a theme in like, we don't have the words for public health, or we pivoted into public health, not knowing that this is where we're going to end up. And I think that just highlights the theme, like there's no one way to get into public health. And I also hear that there's tremendous opportunity right now, and everyone on the call today has a part to play in building the future of public health, of equity, and doing this work. So we're going to dive into some of the discussion topics. Collectively, we've generated a handful of topics that came from the questions that you all shared with us. And I'm not sure if we'll have time to go through all the themes, but we will start off on building resilience, balancing career expectation with personal well-being in public health. And to make that a question, I would ask, what are some public health often involves emotionally taxing and high pressure work. What strategies have you all used or have seen used to maintain resilience and prevent burnout?
Well, I can jump in if that's okay. Um, I have a checklist of things that I think are important for everyone to think about when you're engaged in tough work. My biggest thing that I always ask students that I interact with is start with your why. And that's actually a book. That's a book by Simon Sinek. Start with the why, always considering why you're there. So for me, I always think about who's not here. So for me, I always tell folks I'm not the most talented or the most intelligent person in my family, in my network, in my city, neighborhood, so on and so forth. But I'm here. And so I try to represent those interests. And I take that very seriously. But also trying to find balance. So I celebrate every victory that I can get my hands on. I spend a lot of time with my loved ones and spend a lot of time laughing in community with them. Um, I also begin each day with gratitude. I happen to chair the same department that I got my PhD, and I think to be able to come full circle and engage in some of the challenges that I see, but also to create opportunities for, as I mentioned before, the next generation of scholars, researchers, practitioners. It's a tremendous opportunity. So I always try to start with gratitude and remember why I'm here. Again, starting with the why. So that's why I will have to contribute there.
I can add that for me, even if my research, took me to countries all over the world, I always have a community connection, right? So, for example, I'm a mentor as a part of an organization called Generation Hope, which supports teen parents who are trying to get their college degree. And so sometimes it's like sometimes it's like, oh, it's extra work. I need to do this, but I really do need to do this because sometimes it's, you can get very, bogged down on analyzing data or preparing your study protocols or doing all of this, but you really need to be connected with the people, with the actual communities, right? And so for me, in terms of balancing my personal well-being and in my work, to me, it has been very important to continue to do volunteer work and to be engaged with my local community as well.
And for me, when I start mentoring relationships with students, one of my favorite questions, because it really helps me as a mentor understand how to best support, is to ask our students to reflect on how can you tell when you're in a moment of stress and tension? And how can you hold yourself accountable for noticing it? And how can you have other people help you notice it and connect you to whatever it is that you need to be more centered or to energize you in that moment? So I think as you approach grad school and think about the stress of coursework, just also taking the time to reflect, like, what do you need and what are your telltale signs, and who do you need to tell so that they can also help activate that support when it's needed.
And I'll just add, like, I'm probably not a great example for personal well-being, but like, you have to think that entering this career, all of you are mission driven, you all are interested in helping people, and that is a very valid career path. And you will be doing this if you are successful for another 40 years. So you have to figure out, like, you have to understand that things will change over those 40 years of your career, and that you will have to kind of adapt to different environments, whether it's different presidential administrations, different funding situations, different attitudes about vaccines, whatever it might be. So I think being committed to the cause is really helpful, because you do get benefits and well-being from being successful, but also just trying to elevate, like, your position and trying to, like, move things forward. I think one of the things that's most rewarding to me is kind of in the classroom or when meeting with folks who are interested in public health, seeing the light go on when they, like, figure out, like, how it applies to them, or they finally understand a concept. And I think people who do community health see that when they deal with people in the community who they're teaching about healthy eating habits, or they see that when they're giving a presentation at a stakeholder forum and they're trying to convince somebody that this is an issue with the data they have. So try to appreciate those small wins. Unfortunately, like, our political system is very based on incremental change. There is not big comprehensive reform happening. We are not getting big changes overnight. And so you really have to be willing to kind of put in the effort through the slog of the next 40 years, but realize that everybody's career has that slog. Like, if you're selling real estate, you will have that same kind of those barriers to success and happiness, but at least you're doing something that you believe in, and it will motivate you to like, live to fight another day or have another small win, and eventually things move in the right direction.
I would just add that find your activity that makes you calm. In addition to everything that everyone said, I think the community connection is the key for me as well. But also, I need to make sure I run, for example. So there's that.
Well, thank you for adding there. I think it's so important that we find ways to center and ground ourselves, and to the point that everyone shared, they're like, know your why and why you drawn to this work, and really center that, and also touch grass, touch community, be in relations with people. So we have a lot of really career professionals on the call today. When we think about supporting the next generation, how can career services empower public health students to be successful?
I'm gonna just jump in just because I'm unmuted. So my thinking about career services is really to diversify the idea of public health is everywhere. So really thinking about any job can be connected, thinking about the housing projects that you can work at, Eva worked at, and thinking about how that's a place where public health works happens too. In a school, in a local government, run for office. I will say that repeatedly, but thinking about the opportunities that career services can leverage what you and your skill sets based on the competencies that we're trained in and training our students and graduates, I think that we can be applied in lots of different settings. And remember that you maybe lead with the core competencies of the skill sets that you have, and then find the setting that motivates you the most at the time. Not for 40 years, maybe it does.
I'll add that joining an MPH program in a school and university will also bring you new connections and a new community and essentially a new family. And so I really do encourage career services at all of our institutions to think about how we can better and intentionally network our current students with alums and vice versa. I think that we have a lot to continue learning. You're not done, even if you get your paper and degree. And so this continued share learning experience can really extend for the duration of our careers.
I would add to that what I often see is that students don't always take full advantage of all the services that are available to you, such as career services. So I would encourage you to figure out, like, what is your office of student experience like? Get to know the career services office, who are, at least I'm sure at all of our schools are working very hard to stay on top of this very quickly changing world, right, of jobs. But I would also encourage you to take advantage, go to the talks, go meet with the new speakers. This is all part of your education, not just what you're learning in the classroom, but all of this, there's a method to the madness. It's all intentional, and you should take advantage of it while you're in school.
Yeah, I would agree that like the next 2 years or 4 or 5 years, if you're doing a PhD or DRPH, you won't have this opportunity again to like be embedded in a campus that's hosting events and you're hearing different voices and exposing you to different options. The other thing I would say is if you take advantage of the options that are, the internships you see, the job postings you see, it does help you figure out what you want to do and what you don't want to do. So some of my most meaningful experiences in graduate school were like interning somewhere where that I thought would be the best place to work and I really wanted to be. And then I'm like, oh, after the first week, I'm like, oh, I don't like the culture here. I don't like what they're doing. I don't like what I have to do. And so I got to check that off of my list of potential career paths and follow the right one for me. So I would take advantage of those opportunities because often you have this ultimate goal. Like, you might say, I want to work at this place. That's my ultimate goal. And then if you get exposure to that place, it may not be the perfect situation for you and you can change quickly while you're still in school. That's much harder to do when you're out in the workforce and have kind of been pigeonholed into that field or that sort of setting.
Yeah, and oh, sorry, Mari. I was just going to say, early and often, I think that if you can get in with career services as early as possible, a lot of people wait until they're in their second semester of their second year if they're an MPH student or it's way too late. So the earlier you can get in with career services, the more they can help you and get you ready for the job market. Also building relationships with faculty members. Mentorship to me will break make or break your career. So the more you can connect with faculty members who can say things about you, speak to your out of classroom experience and the skills that you have, the better.
Absolutely. As I always say, you're paying for the school and the resources that are there, so utilize them and, bug the people, like let them know your name and what you're interested in, because that's the best way that they're able to help you. So shifting to the other discussion topic, future-proofing careers in public health, emerging industries and opportunities. There's been a lot of change in public health coming into this year, and I think a lot of you all spoke to the dynamic skill set that someone in public health has. Can you all open up and speak to what do the emerging industries and opportunities in public health look like from your perspective?
Generally, I think that we're looking for students to zoom out and work across different sectors. So I wrote down on my list in terms of skills, design thinking, system thinking, supply chain management, big data, and AI. I think those are some of the skills that people will continue to look for moving forward. And then for content areas, I offered aging, climate change, pandemic preparedness, mental health, and health equity. So to the extent possible, we don't have a crystal ball. We can't see exactly where we're going. But to me, as I've been reflecting in preparation for today, those are some of the big skills that many of our universities offer and expertise that we either have or aging and climate change, for example, are newer and our country is going to need it and need it soon. So those are some of the things that I've been thinking about.
And I think people need to be kind of thinking big picture. Like, so the issues that Liz mentioned are needs that we're going to have, whether the federal government is interested in pursuing them or not. So we're seeing, Office of Minority Health being dismantled yesterday or this morning. We see AHRQ being dissolved. We see all these changes at the federal level. That doesn't mean the need goes away just because the administration doesn't view them as a priority. So the burden ends up falling on states and localities to fill the gap. So maybe you see more opportunities at the state level to pursue health equity in states that are willing to support that. What often happens, though, when the federal government shrinks, they become more reliant on contractors. So going after opportunities that make you an attractive candidate for like consulting firms, what we often call beltway bandits that like service the needs of the suburban Maryland and DC government entities might be good opportunities because eventually a tide will shift, right? So we may see that there's a shrinkage of health-related or public health-related federal funding. But once a need arises and those needs need to be plugged, it's very difficult for the federal government to scale back up and hire a bunch of people. So in essence, what the federal staff who are remaining do is they become procurement officers for technical assistance and task orders and consulting from these private consulting firms. And so positioning yourself as someone who could fall into that world could still make sure you're able to pursue these interest areas in the future, but not think about, oh, I must go work at the federal level or I must go work for state government. You could be attractive to private sector consultants and think tanks that are dealing with those issues on the ground for the federal government or for state governments.
I'm just going to add to both of those comments, thanks to Liz and Dylan, but adding to, I spent several years, probably about 5 to 7 years, building a geospatial institute at our university, and that ended up building out a collaborative across 8 institutions. And that idea was, hey, this is geospatial technologies. And everyone was like, I don't know what that means. But the idea is that there's data everywhere. These data are things that I dreamed of when I was a student. And I was like, these questions that we ask about, I don't know, alcohol use, we're terrible at reporting our behaviors. Is there a way that we could complement these data? So we have data that we're drowning in, and using big data in the beyond the health insurance data even, I would say, what are those non-traditional health related data that are not deemed health? You need to know how to use those data. You need to know how to analyze them and translate those results to something that's important in public health or community health. Those pieces are really important, and geospatial is just location. Everything happens somewhere. So understanding what kind of data we have, from satellite imagery to underground data now that's just coming at us at real time. what can we do with that? We're answering a lot of our climate challenges with those data. We have to the point where we have a lot of big challenges that are going to continue regardless of whether the federal government cares to fund it or not. So one of the things that we need to do is respond to by skill sets, right? So understanding where the data are, how we can use them to answer some of those questions, and be ready to jump when we can.
We've talked about community before, so I agree. Yes, like there's definitely some quantitative skills that are going to be important, but I still think like, there are still going to be opportunities for working in more kind of community-based organizations, particularly I think with this shift in funding where we're seeing this kind of, removal of federal funds. There'll probably be more, foundations working with smaller community-based organizations. And so I think that's definitely an opportunity for public health. And again, I think, continues to underscore the importance of those skills, right? Whether they are in being able to self-reflect on who you are when you're entering communities, checking yourself, checking your biases when you're entering communities. And then also, how are you practicing cultural humility when you're entering different communities? And so I think those continue to be important skills and opportunities that will continue.
So I'm hearing that there are opportunities out there for public health. It might just be in different places than you originally or traditionally thought public health is. So to be respectful of everyone's time, we're going to move on to the closing remarks. So panelists, if you can give us a 30-second to 1-minute keynote on what the critical role that public health plays and what students can do to get involved or make an impact.
I can go. All right. I think that each of us in public health will have a more important role than ever to storytell. So I chose a quote from one of Tom Frieden, who's the former CDC director's LinkedIn posts. He wrote, quote, "It's hard for many people to see the importance of what CDC does because when it succeeds, there isn't an outbreak. Your neighbor doesn't overdose, your cousin stops smoking, or your child doesn't start, your grandmother doesn't develop cancer," end quote. And I think that I aspire to one day not having to constantly answer to the question, what is public health? And wake up and everyone intrinsically understands the value and can point to examples. So I think that no matter where you touch public health, I hope that you are willing to share your work and give concrete examples to others and work to find common ground with everyone that you talk to. It's the only way that we can move forward together is we assume that there's a way for us to do good work together with each other.
Thanks, Liz, and thanks to everyone for making time today. Thanks to everyone from ASPPH to organize. Thinking about quotes, I like to read broadly, and one of my favorite poems is a poem by the controversial Rudyard Kipling, who wrote a poem called "If." And my favorite line from that poem is, "If you can meet with triumphs and disasters, and meet those two imposters just the same." And which means to me, staying balanced. There's always going to be moments in life that you fall down in your career. There's moments of scarcity that many of us have alluded to today. But how you pick yourself up will again make or break your career, because we'll all get knocked down. That goes with our personal lives as well. We'll all experience triumphs and disasters. We'll have highs, we'll have lows. So I think the more that we can do to stay balanced throughout life and having an even keel perspective on the things that are going on around us, the better off we are. So thanks again for making time for us today.
I don't have a quote. I'm just going to say thank you all for letting us do this, having this conversation. I think one of the most important things to do is run for office, support local elections or bigger elections. I don't care where, but get involved. And it's the community voices. So continue focusing on the community voices and use the data wherever they are to support those voices too. Good luck.
And just quick look for me too. I know we're running out of time, but I just wanted to say, like, it's very motivating for me to see that there were so many people registered and who actually participated in this webinar. And do not give up on your dream. If public health and working in public health is your dream, do not let anybody take that dream away from you. The work is out there and we will do this.
And I'll try to stay in my silo around policy. So I think there are lots of students in EPI, biostat, environmental health, community health who have a distaste for politics and health reform and health policy, and they kind of leave it up to the people who specialize in that area. But I think what we're seeing now is that lack of understanding of the policy process can undermine your career as a community health advocate or an epidemiologist because they don't know how to navigate these policy changes and they are kind of left flat-footed. So I would encourage you to really pay attention to your policy courses, try to understand how politics will affect your job, how budgets affect your job, so that when you rise to a leadership position, you can actually protect the programs you believe in rather than being kind of caught unaware or agnostic to the result. So good luck to everyone.
Well, thank you all so much for sharing your wisdom and expertise with us. Thank you all for taking time out of your day to join us on this webinar and being a part of the conversation. We've heard inspiring personal stories from our This is Public Health ambassadors about the unique journeys in the field, as well as the aspirations to create positive change in the world. A big thank you to our panelists of passionate public health faculty for sharing their invaluable insights and engaging in this conversation. We hope you leave today feeling inspired, motivated, and ready to be part of the crucial field of public health. If you have any further questions or thoughts, please don't hesitate to reach out, and good luck to those that are applying to MPH programs this cycle. You can scan this code for a webinar that ASPPH will be hosting later this week for National Public Health Week. Thank you for joining us and have a great rest of your week.
All right. Thank you, everyone. That was fun.
Thank you so much.